Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Leukocytes in urine. What's the normal range? A urinalysis, urine test, can detect leukocytes, white blood cells, in the urine. These cells can be counted with microscopic examination. They can also be detected with a urine dipstick test indicating whether leukocyte esterase, an enzyme in certain white blood cells, is in the sample. /r/n/r/n There should be no or very few white blood cells in urine. A leukocyte esterase dipstick test is considered normal when negative, meaning leukocyte esterase is not detected. With microscopic testing, a normal range is 0 to 5 per high-powered field, HPF. /r/n/r/n White blood cells in urine are a sign of inflammation and may mean there is an infection in the kidneys or urinary tract, bladder or urethra. /r/n/r/n This article will discuss leukocyte levels in a urine chart, what normal leukocyte levels in urine say about health, causes of high leukocytes in urine, and the next steps after a high leukocyte count is found in a urine test. /r/n/r/n Images, Getty Images/r/n/r/n Urine tests, urinalysis, can detect and measure substances such as blood cells, like white blood cells, sugar, bacteria, electrolytes, and proteins. /r/n/r/n Urine is analyzed in a number of ways, including /r/n/r/n Pyuria, an elevated number of white blood cells, or pus cells, in the urine, suggests inflammation in the kidneys or urinary tract, possibly caused by an infection. /r/n/r/n A leukocyte esterase test gives positive results, the substance is present, or negative results, the substance was undetected. If the test is positive, the sample may be analyzed using a microscope to look for white blood cells and other indications of infection. /r/n/r/n Ranges for normal and abnormal levels can vary among laboratories, with differences in measurements or test samples used. Talk with a healthcare provider about what your results mean. /r/n/r/n White blood cells are not typically present in urine. Having no or very few white blood cells is considered a normal result. /r/n/r/n Some measures indicate a normal white blood cell count for urine is 0.5 per HPF, examined under a microscope. Men typically have a count of less than 2 per HPF. Women typically have less than 5 per HPF. /r/n/r/n Verywell Health acknowledges thatsex and genderare related concepts, but they are not the same. To reflect our sources accurately, this article uses terms like female, male, woman, and man as the sources use them. Your healthcare provider will interpret lab results based on your medical history and anatomy. /r/n/r/n The range can vary, but any of the following criteria has defined pyuria, /r/n/r/n Sterile pyuria, persistent finding of white blood cells in the urine, but without the presence of bacteria, may be measured as more than 5 to 8 leukocytes per HPF, with the absence of infection. /r/n/r/n Other measure of sterile pyuria is 20 leukocytes per microliter, with no bacteria. /r/n/r/n These measures may differ from those used by your lab or healthcare provider. Refer to their specifications. /r/n/r/n You will usually be asked to do what's referred to as a cleancatch midstream urine sample, which helps prevent germs from the genitals from getting into the sample. /r/n/r/n Your healthcare provider typically gives you a kit that includes a cleansing wipe, a container for the urine, and instructions for you to follow. /r/n/r/n Follow the instructions given to you, but the general steps of providing a cleancatch midstream urine sample include :/r/n/r/n Leukocyte levels in urine are just one measure your healthcare provider uses to determine your health. Your healthcare provider will consider these results and other factors such as medical history, overall health, and symptoms you are experiencing. /r/n/r/n Certain factors can interfere with a leukocyte esterase test. /r/n/r/n A false positive result when the test incorrectly indicates a condition is present may happen because of /r/n/r/n A false negative result when a test incorrectly indicates the substance is not present may happen because of /r/n/r/n Pyuria can be a sign of a urinary tract infection, UTI, but it is possible to have a UTI without pyuria. /r/n/r/n A 2016 study of 1,181 children diagnosed with UTI found that pyuria was present in 87% of the children and absent in 13%. Compared with children with Escherichia coli, E. coli, a common bacterial cause of UTIs, pyuria was found to be less likely in children with certain species of bacteria, such as /r/n/r/n UTIs are a common cause of leukocytes in urine. They are caused by bacteria entering the urethra, the tube that transports urine out of the body. The risk of contracting a UTI can be increased by /r/n/r/n White blood cells in urine can be caused by many other conditions, including /r/n/r/n UTIs are common in pregnancy. UTIs may be symptomatic, such as a sense of urgency, painful urination, frequent urination with small volumes, straining, or a residual feeling of incomplete emptying, or asymptomatic, without symptoms. /r/n/r/n UTIs may increase the risk of complications such as /r/n/r/n if untreated. A UTI could develop into pyelonephritis, a kidney infection, which has been associated with complications such as /r/n/r/n pregnant person, /r/n/r/n fetus/infant, /r/n/r/n routine screening for UTIs is common with prenatal care, with or without symptoms. Talk to a healthcare provider if you have symptoms of a UTI or have any concerns. /r/n/r/n High leukocytes in urine are not enough on their own to make a diagnosis. Your healthcare provider will talk to you about your symptoms and your health history and may choose to run further tests. /r/n/r/n Your healthcare provider may also do a physical examination, which may include a digital rectal exam to check for a swollen or enlarged prostate that could be blocking the bladder. /r/n/r/n If your healthcare provider diagnoses you with a UTI, they will likely prescribe antibiotics to clear the infection and prevent it from progressing to a kidney infection. The exact treatment will depend on the cause of the UTI and your personal health considerations. /r/n/r/n It is important to take all of your antibiotics as directed and follow your healthcare provider's advice to ensure the infection is fully treated. /r/n/r/n Depending on your symptoms and other factors, your healthcare provider may want to run other tests such as /r/n/r/n to help ease symptoms of a UTI while treating the infection. You can try to do the following: /r/n/r/n Leukocytes are white blood cells. Leukocytes may be detected in urine using a leukocyte esterase test or with an examination under a microscope. White blood cells are not normally found in urine, so a normal level is 0 or very few, typically 0.5 per HPF. /r/n/r/n Leukocytes in urine are a sign of inflammation and may indicate an infection. They are often due to a UTI but could be caused by several other conditions. /r/n/r/n If leukocytes are detected in your urine, your healthcare provider may make a diagnosis based on this result, along with other factors such as your symptoms and an examination. If needed, more tests may also be ordered. Talk to a healthcare provider if you have symptoms of a UTI or other concerns. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.